Good evening, everyone. I hope that everyone is well and staying home and sheltering in place. Today is Thursday, April 2nd, and I actually want to start off just by saying thank you. We had some big news today, which is that we have some newly released modeling data from an expert that we hired out of the Imperial College of London. And I want to say thank you because what this modeling data is showing is that our shelter-in-place order is working. And I want to give an especial thank you and shout out to all of my fellow parents who have now become teachers and are taking care of all of their wonderful little darlings at home 24/7 and trying to teach them and educate them and parent them and sometimes also work from home at the same time. I also want to say thank you to all of our non-essential workers and non-essential businesses who are sacrificing financially right now in order to take care of our broad public community health. I want to acknowledge the financial hardships that many are experiencing, and I want you to know that I am working night and day with our state and federal partners to try to ensure that we have the resources for those who are most economically impacted by disaster. And I know that a lot of our small businesses are hurting, and a lot of our small business employees are hurting as well. I also want to say thank you to all of the people who are following the shelter-in-place order and who are also following social distancing and sanitation practices when they are out in public conducting essential activities. And of course, a huge shout out to our frontline workers. That would be our grocery store clerks, our pharmacists, obviously our healthcare workers, bankers, anyone who is classified as an essential business. I want you to know that you are on the front lines and you are appreciated and that everybody's work is actually paying off. That is what the modeling data is telling us today, and a little bit more on that later. I'd like to provide the usual update on what the number of cases is in Sonoma County, where they are, and kind of the demographic information that we have available tonight. So as of right now, there are 95 total cases of COVID-19 in Sonoma County. Of those, 79 are active. 15 are recovered, and we do have still that one fatality. I also want to acknowledge that we suffered a loss in our community this week. Detective Mary Lou Armour passed away, and she was a member of the Santa Rosa Police Department, and I know that our community is mourning her loss. And I think it's a little bit strange because even though she's a part of our community, and so it was a loss for Sonoma County, she is not sort of actually tallied in the local fatality count, and that's because she was a resident of another county. So I've had a few people ask about that, and I just wanted to clarify that there's sort of the public health hat that we wear, wherein you have your statistics and they are calculated a very specific way so that we don't have any redundancies between counties. But there's also just the more human way, and in that human way, I want to acknowledge that she was absolutely a member of our community, beloved by many, and that it's a huge loss for the city of Santa Rosa and the county as a whole. Back to those total cases. Of those 95 cases, I do want to acknowledge that we actually do have 3 cases in the 0 to 17 age range. This is unusual because, we don't often see symptomatic children, and so I wanted to acknowledge that up front. We have 50 cases in the 18 to 49 age range, and then between 50 and 64, those ages, there are 27 cases. And finally, we have 15 cases in the 65 and older range. When we're looking at it geographically by region, we've got 16 cases in North County, 13 in South County, 15 in East County, 12 in West County, 35 in Central County, and then 4 under investigation. So as you can see, it still is spread all around the county. There are no major hotspots, no major clusters, no part of the county that is untouched by coronavirus. Again, this is everywhere, and so we need to acknowledge that whenever you're going to the grocery store or the hardware store or to the pharmacist, that you need to make sure that you are following those best practices. In terms of the gender demographic, we have 47% are male and 53% female. If you're wondering where these cases came from, how people caught coronavirus, the transmission rates are as follows. 29% came from travel, 22% came from close contact with a confirmed positive case. So that would be likely if you have a spouse, you have a dear friend that you know that you spent time with and they were positive and then you became positive. 19% are community spread, meaning that we don't actually know exactly where or how they were exposed, and then 29% remain under investigation. So the big news today that I want to share with you is about our modeling data that we released today for the public. And we first had a press conference this evening, and we're working on making sure that we have all of those graphs available on the website. I was planning on sharing the graphs with you, but I forgot that when I'm doing this view that everything winds up backwards. So when I try to show you something, it's in mirror image, which makes it a little bit difficult to read. So instead I'm going to summarize things. Now, if you're a data nerd like I am, you'll enjoy the fact that there is finally data, because this actually is something that we can use to then drive our decision-making process forward. But once you look at the data, you might be a little bit sobered to look at what is on the x-axis, which actually has the number, not in what you would hope to see, which is, maybe a number of weeks, maybe a number of months, but actually looking at hundreds of days and kind of how long this curve could possibly stretch. So here's the good news, is that we are flattening the curve, and so everyone's sacrifice and hard work is actually paying off, and we are seeing that curve in Sonoma County bend. But as that curve bends down, it also lengthens out. And so we're looking at, at what point do we start to think about lifting those shelter-in-place orders? I know that everyone wants to know that. And so I'm just going to share really briefly, I'm going to pull up some of the main highlights from the graphs, and I hope that you'll all take the time as soon as we post this town hall online to listen to the fantastic Dr. Mace actually go through each and every graph, explain very, very carefully, and we also had real-time translation, so it's in English and Spanish, exactly what the graphs mean and what you can expect. But in the meantime, I'd like to provide a little bit of a high-level summary. So essentially, the news is that without shelter in place, COVID-19 would actually overwhelm the county's healthcare capacity by 6 times more. So we would see an absolute huge surge. This would obviously create very hazardous conditions, not only for those folks who are COVID positive, but for anyone else who has the normal standard concerns. Our hospitals would be completely overwhelmed with patients. So we don't want that to happen. But the modeling does show that our shelter-in-place intervention has had a direct impact on flattening the curve and continue to do so. The modeling also shows, which is what we've sort of expected all along, that if we didn't have sheltering in place, our population that's age 65 and older would be the most heavily impacted in terms of mortality and fatality. And that by bending the curve, we actually are significantly reducing the fatality rate in that population. However, it's interesting to note that the model suggests that the greatest number of hospitalizations actually takes place in the ages between 18 and 64. So we would actually have our hospitals filled mostly with people in that age range. And we do reduce the risk to the 18 to 64 age group by sheltering in place as well. Even with sheltering in place, though, the county healthcare system will need approximately 1,500 hospital beds at the peak of the surge. And we also expect the peak of the surge to occur in approximately 2 months, approximately 60 days from today. So that is new information. And obviously, when you think about, our shelter-in-place order expiring in early May, we start to think about at what point can we start to lift those shelter-in-place orders if that surge going to be expected to peak in 60 days. So a little bit more on that later. The data also shows that without any other interventions, such as a vaccine or intensive case finding, testing, and isolation, even if the shelter-in-place order was lifted after the pandemic surge in 60 days, we would actually experience a resurgence. And even a resurgence the following year would require 3,000 hospital beds, so twice the sort of capacity that would be required by the surge that we're expecting to see in 60 days. We have shared these results with our healthcare partners to assist with their surge planning, and we are actively working on surge planning and alternative care site acquisition as well. And hopefully in the next couple of days, we will have an announcement to make about entering into contract with a facility that can provide for alternative care sites. So having this data is really going to help us drive our decision-making processes into the future. And I do want to caution you that when you look at these graphs and you see sort of the length of time that stretches along the x-axis, recognize that it is a sobering moment to think about, okay, even if we were to relax shelter in place a year out, absent other interventions, we would see a surge that would require 3,000 hospital beds. That's a very sobering assumption to make, but what you have to remember is that's absent other interventions. So we are actively thinking about what else can we do besides shelter in place that could actually help to control the virus coronavirus spread in our community. So we're looking at things like dramatically expanding testing, right? There are now some protocols in which, people have their temperatures scanned almost wherever they go, right? Going into a grocery store, going into a medical facility, wherever you go, you're constantly being monitored for potential signs of infection. And then also really robust contact investigation. That's another intervention where you can actually make sure that any person who tests positive, you are deploying a really, really robust investigation to make sure that you are contacting every single person that person might have been in contact with, and then making sure that they are also self-isolating and quarantining. So there are other interventions besides shelter in place, and that's actually what we're going to be looking at with round 2 of the modeling data. So we're going to be asking our modeler to say, hey, what would it look like if, for instance, we relaxed shelter in place, but we implemented these other strategies? And so that's hopefully going to provide us with more information that we can use to drive the decision-making process. So, and actually I do have that someone asked how many have been tested in our county, and we were getting close to 2,000. I normally write that down on my notepad, but I didn't actually write it down. I believe it was around 1,900. Let me see if I can pull it up for you. And I will apologize in advance. My husband is putting my 1-year-old to sleep, and so he was a little bit of we call him zombie boy when he keeps waking up every time I try to put him down. So I'm on my own today. So we're at 1,915 tests. So now I'm going to try to see what I can do in terms of answering questions. So please go ahead and let me have your questions, and I will try to answer them as best as I can. I have a question about a surge with the current shelter in place. So we do anticipate a surge with the current shelter in place, because even when you have shelter in place, you're still just bending that curve. The peak of that curve is expected to be about 60 days from now. And there are various epidemiological assumptions that are being made. I can go into the nitty-gritty details if you are interested in that. And let's see, other things about the surge is that it would peak around 1,500, and I do have the data about the number of hospital beds that we currently have. So, so the peak of the surge would be 1,500, and we currently have, let me see, I know I took a note down here on our EOC briefing, we currently have 916 hospital beds. So we do have a need to create surge capacity for that anticipated 1,500 bed peak about 60 days from now. But the good news is that because we've been flattening the curve, we actually have more time to build out that facility. And so we have an opportunity to get ready for the increase in patients that we know will come. So I'm going to try to scroll down and see if I can find any questions. Okay, I've got the testing. So testing was 1,900. I have a request to protect frontline and undocumented workers of Sonoma County. Absolutely, that is something that we're definitely focusing on. I actually had a great conversation with Christy Lubin of the Grayton Day Labor Center about some of the needs of our West County undocumented residents, and we're working on food provision. I'm also trying to find ways to support UndocuFund. One of the challenges for undocumented residents is they will not be eligible for the federal aid package that was recently approved, and so we need to find ways of supplementing them and providing them with assistance either at the local or the state level. So we are definitely working on that. Great question from Damien. When do you expect that additional modeling data will be available? I don't have a date yet for the next round of modeling, but I do know that this is happening in real time. And what we received today was really just the very preliminary information. And one of my biggest goals is that as soon as I have information, I want the public to have the information as well. So I can tell you that the Board of Supervisors just received a preliminary briefing on this at 8:30 a.m. this morning, and then at 5 p.m. we had the press briefing, and that just was giving them time to make sure that we had everything ready to be translated into Spanish to actually finalize, because we just had the very preliminary data that was not even for public dissemination, not even formalized from the modeler this morning. So we're trying to turn it around as quickly as we can and keep you informed in real time. So the next time we've got the modeling data, we will definitely share. Another question is, where can we view these charts? They will be posted on socoemergency.org. I know that our ISD, our Internal Services Department, has been working all day to try to get them posted, and I have also shared them on social media, some of the screenshots I had. So you can check out my Facebook page as well to look at some of those graphs and graphics. All right. Is the county limiting tests, or do they just not have any? Will widespread testing? This is a great question. We are not limiting tests, and we are actively encouraging our healthcare partners to test people. We have actually issued guidance to institute more proactive testing, including testing of asymptomatic folks. And so we're especially looking at proactive testing in some of the higher risk populations. That would include healthcare workers, first responders, as well as, for instance, people in the jail, because that's obviously close confines and coronavirus could spread very quickly, and also our unsheltered or homeless population. So we're encouraging proactive testing. As you might have heard, the current limiting factor on testing is lack of availability of the testing swabs, and so we are also actively working on sourcing those swabs so that we can provide those to our healthcare providers. Our public health lab still has testing capacity. So, if we get more test samples, we actually still have the ability to process more each and every day. We're just waiting on those additional samples from the healthcare providers. And I know that the challenge often right now is the actual testing swab that is used to obtain the samples. So I am a good question. The question was, is it 60 days or 16? And it is 60 days is when we anticipate the peak of the surge, of the sort of flattened curve that we've created through the shelter in place measures that we're taking. But I want to remind everybody, shelter in place is absolutely critical right now. And that is the best way that we are flattening the curve. But we are actively exploring other methods for flattening the curve, including that robust contact investigation, really aggressive quarantining and self-isolation. So there are a number of strategies that Dr. Mace is currently looking into, and that's what we're hoping the next round of modeling will show. What would it look like if we implemented those measures and maybe relaxed some of the shelter-in-place measures? So, looking for the next questions. Where can employees of small local markets get PPE and sanitizer? Our suppliers are out of stock and Amazon is reserving for government and healthcare. That's a fantastic question. And we actually have a number of different companies, and I sent it out in my last email newsletter, and we can post it again to social media, who are manufacturing hand sanitizer locally. A number of the distilleries have actually stepped up. So places like Spirit Works, which is in the Barlow and Sebastopol. I know there's one in Petaluma as well that is also manufacturing hand sanitizer. And so that's a great source for hand sanitizer, supporting those local companies who are stepping up. With respect to PPE, the county is looking at acquiring large-scale PPE supplies, talking about hundreds of thousands of masks. And so that is something that we're actively working on sourcing to ensure that we have adequate supplies in our community. We obviously will be prioritizing healthcare workers and first responders, but I absolutely believe that grocery store workers and people who are in contact with the public should be that right next tier to be prioritized for PPE supplies, because I want to acknowledge that you are exposing yourself to the public every day, and you're providing an absolute critical function, which is the ability for us to go get groceries and keep ourselves fed through the duration of this pandemic. So I am looking over here to see. Question on, I'd said that I would check into the self-tests or rapid tests and when they might be available. I did pass this information on to the public health department, and they are researching this. Unfortunately, they are not available just yet, and I'm not sure when they will become available. I think there are a lot of great ideas that are in the works, and yet, unfortunately, they're not widespread or available on a commercial scale like we need to have to implement them quickly and locally. But it's exciting to see all of these new developments in the medical field, and please know that we are tracking them closely, and we're going to definitely avail ourselves of any new technology that comes online that would enable us to test more people more quickly. So this great question is, how are we doing with the number of ventilators, and what is the plan to obtain more? This is a challenge with respect to the healthcare system. The challenge is that we have a very fragmented healthcare system. So at the county, we're trying to think about what the county's capacity and the county's needs are, right? We're looking at our population, the number of hospital beds we have, the number of ventilators, the amount of PPE, all of those things. And yet when you talk to our healthcare providers, they're actually thinking about what their system of care needs are, right? So Kaiser, for instance, is thinking about all of the Kaiser patients in the state of California. Will they have adequate surge capacity for their people and their patients that are, part of their healthcare system? Similarly, Sutter is looking at Northern California, right, where their sort of geographic reach is, and what is the capacity that they have to surge for all of their patients and all the people who have their insurance. And so It's been an interesting, and I'm not part of these conversations that are actually happening between the public health department and the emergency operations center and the healthcare providers. But I am getting the sense that, we're trying to look at one thing and they're sort of looking at another. So when they're thinking about ventilators and PPE, they're thinking about it within their system, whereas we're trying to look at what are the needs within our community. So that's actually a little bit of a side note, but and perhaps a long way of saying I do not have a specific number of ventilators, nor do I know what the surge requirements for ventilators would be. But that is definitely something that I will look into, because I have gotten a couple of questions about what is the ventilator capacity and availability. And so I've got the number of hospital beds down, but I will certainly look into and take a note to see what I can find out about ventilators locally. All right. Someone commented that lifting the shelter in place would be a huge mistake, costing lives and dragging this out longer. And there is no, plan to lift the shelter in place order early. So it currently extends through May 3rd, and we will absolutely be using data to guide our decisions going forward. And I want to acknowledge that the only reason that we are not seeing a huge exponential increase in cases right now in Sonoma County is because of the shelter in place order, and is because a majority of our Sonoma County residents are doing the right thing and staying home and sheltering in place. So thank you to every single one of you who is like me, holed up in the house. It is really the thing that is saving lives right now and keeping our community safe. So question is, which updated precaution outcomes are you going to be releasing first, or several at the same time? We will release data as soon as it comes to us. So actually, when you do get to see the graphs, and I feel odd that I'm talking about these graphs and I can't show them to you, but you will see that we actually released a number of graphs. One of them is actually about mortality rates with shelter in place and without shelter in place by age range, and you'll actually see the dramatic difference in sort of the percent of mortality that we would experience in these different populations with a shelter-in-place order and without. There is also a graph that talks about, what happens if and when shelter-in-place is lifted, and what would you see with respect to the different populations and the demand on hospital beds. So there are a number of different graphs that will be released and have been provided to the press already. So stay tuned. As soon as we get that information, we will absolutely share that with you. I've got a question. Do you anticipate us sheltering in place longer than May? At the end of the day, this is Dr. Mace's call, and she is the absolute subject matter expert. But I would say, just based on my own kind of common sense, that if we're looking at a peak that is not going to occur until 60 days out, that we can expect sheltering in place to likely be extended beyond that May deadline. There have also been other signs that is probably the case, right? The state of California just let everyone know that schools will be closed through the end of the school year. And so I think that we have signs that we will continue to live in some form of shelter in place in order to contain the spread of the coronavirus past the current order. So again, not my call, and I'm not an expert, but signs point to that's the way that it's going to go. That's a great, I have another question about expansion of testing. We are absolutely supporting expansion of testing. As I mentioned earlier, the swabs are the limiting factor, and I think the antibody test would be a great thing. So Carol mentioned that there's a new antibody test coming out next week from the Mayo Clinic. I would imagine that, there are all of these cutting edge technologies coming out from medical facilities and universities across the United States right now. Supervisor David Rabbit mentioned to me earlier today that his wife works at UCSF, and they have 14 different clinical trials on COVID-19 treatment undergoing right now. And so that's just one facility, right? One university facility here in the Bay Area, and we have hundreds of different top-notch universities and medical facilities that are working on these things night and day. So, let's see. Would this expected surge cause a longer shelter-in-place order? Ultimately, that shelter-in-place order is going to be driven by data, and I mean this. So it comes back to the modeling, and trying to get a little bit more information from those modelers in terms of what are the interventions that are going to ultimately make sure that we keep that curve under our healthcare capacity. So that's the biggest thing with flattening the curve, right? You don't want it to get to a point where your healthcare system is completely overwhelmed, and then you experience fatalities not only from COVID-19, but also from just a lack of bed and physician availability for other things that would normally be treatable. So, So this is a great question. Can you help us understand how there is a 60-day lag in the surge when the virus has approximately a 14-day max incubation? So this isn't exactly the surge, right? It's the peak of the surge. So when you think about, so this is kind of the best I can do, right? So you've got a curve, right? This top point, this apex of the curve, that is what is 60 days away, right? So we're still going to be seeing the increase in cases up to that point, and then after that point, they will start to decline again. So the surge is really just the peak or the apex of the curve that we are seeing, and so hopefully that will that helps clarify that. I see a comment about vacation rental abuse being ongoing and the posting of vacancies seeming to be higher and higher. It says the vacation rental violations need a mandatory fine. So we are working actively on this, and my office is constantly making referrals regarding reported illegal vacation rentals. Right now, the best way to address illegal vacation rentals is through calling the non-emergency line for local law enforcement. I'm also still working on seeing if we can create surge capacity, since that seems to be our new favorite phrase, around enforcement. So if Permit Sonoma could actually go out and proactively scan a lot of the different advertising that's happening. Our new shelter-in-place order actually has some really strong language that essentially prohibits advertising of these things to out-of-county residents. Right now, vacation rentals are really only supposed to be used for quarantining or self-isolating of county residents. And if they're providing any kind of shelter for out-of-county residents, it has to only be for essential workers. So for instance, a traveling healthcare worker would be an appropriate use of a vacation rental. But you cannot, it's absolutely illegal and in violation of a public health order to rent a vacation rental for tourism purposes, or even to an out-of-county resident just who wants to quote-unquote self-isolate for a few days, because I've seen that excuse used a lot, and that excuse no longer passes muster with our current public health order. So please continue to report those vacation rental violators, and we will absolutely go after them. Because they are endangering the public health. And I recognize that it's really hard times for a lot of small business owners, and that some small businesses, manage vacation rentals for a living. They will have to lay off workers or furlough workers. I want to acknowledge the economic impact, but we have to prioritize the public health. And right now, vacation rentals of people coming and staying for a couple of nights has a tremendous potential to spread disease, especially since you have those people coming through the same house, and there is likely not being the sort of high level of disinfection standards that would be needed to actually sanitize all of the surfaces. So this is a great question. Are there any plans to get in place to get homeless in hotels? Yes, and the county is actively working on that. That is actually going to be part of the alternative care site that we're hoping to have an announcement in the next day or two. We just don't have the contract signed with the facility, so it's not a done deal until we actually have that contract inked. But once we do, we will be able to announce surge capacity not only for a healthcare facility, so to stand up a place where we could take non-acute COVID patients for quarantining and self-isolating of COVID patients who don't want to return home to their families but want to go someplace to stay safe and have someone keep an eye on them, as well as for our unsheltered individuals. And so we are looking at a suite of solutions that would cater to all of those different populations. So please stay tuned. Hopefully in the next day or two we'll be able to make that announcement. So let's see. I have a question. The chart that I shared suggests some modeling based on lifting the shelter in place around 500 days. Could I elaborate? So this is a great question. And I know this is one of the things that will likely cause a lot of anxiety in the community when you see just the length of that x-axis that stretches on for 500 days. And so this was just something that the modeler ran, which said, what would happen if we implemented a shelter-in-place order and then we lifted that shelter-in-place order with no other measures after 1 year? After a year, we would actually see another resurgence of COVID-19 that would actually cause about 3,000 hospitalizations. But the critical factor here is that is absent other interventions, right? So that's looking at shelter in place being the only intervention that you are putting in your community. And so you're just testing that one factor of shelter in place. If this is what the growth of the disease is, and you lift that order, then what are you going to see in terms of a surge or a spike? And so the good news is that there are other interventions. Obviously, the biggest and most important intervention that we can hope for is a vaccine, right? That would be a game changer, absolutely, across the country and around the world. But other interventions that I mentioned earlier, aggressive contact investigations, aggressive self-isolation and quarantining, aggressive testing, and even thermal scanning as people go from place to place. So there are a number of things that we can consider. Also looking at, the potential for universal masking of everyone, right? If we were able to get a lot of PPE, that might be another intervention that could be considered. And there is likely guidance coming out surrounding wearing face coverings in public. So we're still at this point really focusing on PPE is for healthcare workers and first responders. But for others, and if you're someone who enjoys sewing, there's lots of different designs that I've seen floating around online. Making those homemade masks can actually help protect, especially other people, right? Because it's going to obviously, if you have the disease, keep your contagion more contained. And so it's a good thing also for our grocery store clerks, right? If everyone who's coming in is actually wearing a protective face covering, that can somewhat decrease the risk of transmission. It's obviously not foolproof, and we want to make sure that we're reserving the really highly technical equipment for our healthcare workers. All right, I'm going to try to see if I can scan and see if there are any more. Oh, this is a good question. What about the animal shelter? Is this going to be if this is going to be an ongoing lockdown, can the county find a way to allow adoptions? Right now they are not happening, but I would love to foster or adopt during this time. Can it be by appointment only and we keep our distance? I think this is a great question, and I will definitely follow up with animal services on this. I want to give a little plug for Dogma Animal Rescue in West County. They do amazing work, and so there are a number of foster to adopt and foster organizations that operate independently outside of our shelter system. And so if you're wondering, definitely reach out to Dogma. They have a wonderful track record, and they actually adopt some really, really tough cases, animals that would otherwise be euthanized, who have been through traumatic health experiences, and they do really good work. Another one is, I think it's called Compassion Without Borders, and they also have an active adoption program in Sonoma County. So I would say check out the nonprofits, and I will definitely follow up about animal services. I do think that when we're looking at this kind of data that suggests that the pandemic will be with us for quite some time, we have to start thinking other ways that we can, keep business and community alive. And I absolutely think that adoption is one of those, right? Let's, if there are ways that we can get creative and make sure that we aren't causing big gatherings or having lots of people come into a particular place, let's make sure that our pets are taken care of and that we're taking care of each other as well. Question from Mara around homelessness in Guerneville. Will they get any help? Absolutely. We are working to create that surge capacity and an alternative care site, specifically to get our unsheltered residents into shelter. So please stay tuned for that announcement. I actually just heard also some really wonderful news, which is that Alliance Redwoods, out by Camp Meeker, they actually have stepped up and offered to put 80 homeless people up at their camp right now, because obviously their camp is closed for camp activities. And so they're partnering with the Redwood Gospel to take clients, and they're planning on sheltering them and feeding them. I just heard about that from Jim Blake last night, who's the executive director out there. So there are some wonderful people who are stepping up and doing wonderful things of vulnerable community members right now. And so one of the reasons that I'm very proud to live in Sonoma County. This is a great question from Jorge. Is the county doing outreach to essential businesses to help them implement the new health order? Absolutely. And this is something that I've been really focusing on. So we are trying to make sure that everyone has access to what the best practices are for their particular business. And actually by tomorrow, all businesses are required to have a plan in place to protect not only the public, but also their employees. So that involves things, like hand sanitizer being, available for folks to use, how they've been operated is not in a way that allows for social distancing. So we're trying to make sure that we are implementing practices to really make sure that we're keeping the community safe. Great question on property tax relief. There was actually just a press release that was sent out by our tax collector, Eric Rozier. I will definitely post that on social media. I haven't even had a chance to read it yet, but here's just what you need to know in a nutshell about property tax relief. So it's actually the state that would have to extend the deadline for property taxes, right? So we actually can't do that on a local level. What we can do on a local level, and what we're trying to do, is make sure that people are not punished for an inability to pay their property taxes due to COVID-19. So it's a challenge, and we're trying to make sure that we're on the right side of the law, because there's been case law about, financial hardships not being a reason to waive a fine. But I really do think that we're in a new era where we're facing a first-time pandemic disaster in Sonoma County, and we need to acknowledge that some people are being hit harder by this economically than others, and that they shouldn't be punished if they have an inability to pay their property taxes. So I will definitely share the press release that went out, and hopefully that has a little bit more information from tax collector Rozier. All right, let's see if I've got any more. Let's see, has it been suggested to test more aggressively to see exactly how many cases we actually have? Like the asymptomatic cases that might be out there spreading without knowing. Yes, and that is actually something that is in our plan. I mentioned this a little bit earlier, but folks who are at high risk, including our healthcare workers, first responders, folks in the jail, as well as our homeless residents, we are advising healthcare facilities to proactively test asymptomatic individuals. And actually I had some really interesting information. These are some of the assumptions that went into the models, and I think that it actually provides some interesting information about the coronavirus. So the assumptions that go into the model that we're releasing the data from are that 2/3 of the infections develop symptoms. So that means that 1/3 of the people are asymptomatic, right? And the other interesting thing is that the assumption is that symptomatic infections are 50% more infectious than symptomatic. And that's actually not a huge difference, right? So you actually have 1/3 of the population who is actually still capable of spreading the disease, and yet they are asymptomatic. And so I think that's one of the things that has made this disease a little bit harder to contain than others, is that you do have asymptomatic carriers who could be walking around in the community and, unbeknownst to them, spreading the disease. And not at a completely tiny rate. It's not like it's only 10% compared to a much higher infection rate among symptomatic individuals, but they still do have the capacity to spread the disease. So I also wanted to sort of share a few of the other assumptions that went into it. The reason that this modeling data is so important is that it actually looks at Sonoma County specifically. It's not just sort of saying, okay, Sonoma County, random county of 500,000 people, and we're just going to sort of apply a generic model to it. They looked at our population, they looked at our demographics, they looked at the ages, they looked at what percent is urban and what percent is rural, and what that might mean for the transmission rate. So for instance, they made the assumption that 70% of the county population is urban, the remainder is rural, and that the reproduction number, that R naught factor that everyone talks about, in rural settings is 75% that of urban settings, because you do just have sort of less community contact and less use of common surfaces. The other assumption was that the shelter-in-place order succeeds in cutting the reproduction number, or the R naught, by half. So that's what we're doing right now, is we are cutting that R naught in half by staying home and protecting those vulnerable members of our community. All right, I'm going to scroll through and see if I can get other information, other questions up here. Let's see. This is a great question. Has there been discussions around assisting those of us who are required to stay home from work and have been laid off but are still expected to pay rent and are now late? This is one of the most critical issues in my mind. And I want to acknowledge that people who are considered non-essential businesses and non-essential workers are making a huge sacrifice for our entire community right now, at considerable personal financial detriment. And so I have been working with our state legislators, I have been working with our federal legislators to make sure that we have support for those people. And so I am hopeful that the CARES Act that was just signed into law a couple of days ago, and that the federal government is working at relatively lightning speed for the federal government in order to implement. Actually, small businesses will be able to apply for forgivable loans starting tomorrow, which is really, really shocking at local banks that they were able to move that quickly. That we are trying to make sure that those workers are covered. And I do want you to know that we did pass a local tenant eviction defense ordinance at the Board of Supervisors, and so that would apply to any tenant, which is basically means that if you can't pay your rent because of the pandemic, because of the financial impacts of the pandemic, your landlord cannot just kick you out because of that, right? That you can actually use that fact as an affirmative defense against eviction. And I want to acknowledge that it does create an impact to the landlord, but there was an action by the state that allowed mortgage deferrals for a number of months, depending on which your lender is. So we're trying to cover everybody. And I know that everybody's needs are unique in this moment. And so if you're falling through the cracks, if you're not seeing the support that you need either at a local, state, or federal level, please let me know, and I promise that I will fight for you. I will try to make sure that you have what you need. I did also hear actually from our federal representative, Congressman Thompson's office, that it's looking like those stimulus checks will probably take about a month to actually arrive in people's and I think they're actually going with checks, and so I think it's going to be mailed, although I don't think that that's completely settled yet. So I do want to acknowledge that there will be a lot of bills that need to be paid until those checks arrive in a month or 5 weeks. And so we are stepping up to provide food resources for people who can't afford food. That's why I think it was really critical to have that tenant protection ordinance. We're also going to be discussing on Tuesday, Board of Supervisors on April 7th, what we could look like for a commercial tenant defense type of an ordinance, because I've heard from a lot of small business owners that they're really struggling to pay their rent as well. So a lot of conversations are going on about how we can protect the folks who are taking the biggest hits financially. And please send me an email, linda.hopkins@sonoma-county.org, if you have needs that aren't being met, and I'll see what I can do to try to advocate for you. All right, a few more questions. I have a question from Jessica. How many kids have been tested? I do not know that. That is a great question. I don't know that we have the testing information by demographic the way that we do the positives. But one other piece of information that I really want to find out, and I'm hoping that maybe once we hit sort of 100 cases that would be allowed to be released. It was being reviewed by our privacy officer. Is what of the different hospitalizations that we're seeing in Sonoma County, what's the demographic breakdown of those? So, for instance, are we seeing hospitalizations in children? And I'm not. I'm just asking the question, right? What is the percent of hospitalizations that are 65 and older, or 45 to 64 breakdown? So I will follow up on that and see what I can learn, and if we're able to share that information without violating HIPAA. Okay. Let's see. Question, can we limit the number of people allowed to enter grocery stores? Yes, and actually some grocery stores are already doing this proactively. I think that by requiring grocery stores to actually implement best practices in terms of social distancing, we'll likely see those measures that have been implemented in stores. Like I think Costco was doing it. I think Trader Joe's was doing it. I think Oliver's might have been doing it as well. But we need to make sure that everyone is in line with keeping social distance and maintaining those sanitation practices. All right. I am... And it looks like Mary says, I heard the peak would be April 23rd this morning. Was this revised today? So one of the challenges is that the peak is going to be different in a lot of different places. So for instance, you look at Santa Clara County, San Mateo County, some of the parts of the South Bay will peak earlier than we will. And that's actually good news, because that actually means that you can create regional surge capacity, right? So different hospitals in other counties could provide overflow for those counties who aren't yet at their peak and don't yet have the capacity of their healthcare system maxed out. So I'm not sure where the April 23rd date came from, but it might have been, a sort of national or another city or just the state. This is the first time that we have had Sonoma County specific data, and we are expecting that peak of the curve, of the flattened curve, to occur about 2 months from now. All right. Any other questions before we wrap up? Let's see. Can rental agencies notify neighbors when they rent a house? That is a great question. So first of all, rental agencies should not be renting houses to out-of-county residents for tourism purposes, or even for sort of self-isolation for a few days. That's code for corona tourism, which is not okay, right? So I will definitely look into what kinds of notification processes might be set up in order to address, if someone has, for instance, healthcare workers that are staying in their vacation rental, which would be illegal use. I will definitely follow up on that. All right, a couple more. Leo noted that Spirit Works left our office a voicemail today saying they're out of hand sanitizer. So if they have more available, we will let you know. So I think it was the other place in Petaluma maybe that still has hand sanitizer. I don't know if Leo, if you can chime in with what the name of that one is. I forgot. So I'm going to try to wrap up with a couple more questions. Yes. What about the long-term loss of income and jobs? What happens when people get desperate and hungry? This is a very sobering reality that we are facing. Which is that we may be looking at prolonged shelter in places or other measures that will be counter to our local economy, right? Which has been very much based on tourism, on retail, on local restaurants, on just having places where you can go and where people can gather. So rest assured, we are working on not only short-term fixes, but medium-term and long-term. They're already actually discussing the next financial aid package on the federal level and trying to make sure that we have resources available. I was on the phone this morning with Senator McGuire, my colleague David Rabbit on the Board of Supervisors, and other business leaders in the community to talk about how can we also help businesses adapt, right? Is there an opportunity, for instance, to try to create a local online retail economy? So if you have a toy shop or a bookstore that's closed, how can we provide them with what they need to set up a little e-commerce website and then to be able to do local delivery, so that instead of us sending all of our money to Amazon where it comes from some big warehouse, a big corporation, that we could actually create almost an alternative pandemic economy here. So we're having all kinds of conversations, but and I also want you to know that food provision is critical. Different nonprofit organizations for $100,000 each. So the county is putting $500,000 into providing food. Redwood Empire Food Bank, Ceres Community Project, Meals on Wheels, Sonoma Family Meals. We are standing up and supporting all of these organizations who are delivering food all around the county. So if there's any need for food, go to socoemergency.org, and we have a whole list of all of the food resources where all the different food bank drop-offs are, and you can also actually call to get it delivered to your home if you're self-quarantining or if you're self-isolating. All right. It was, even the DMV, if you needed to replace your driver's license, that we try to get everything in one place to make it easy for people to recover. Since we can't do that in the midst of a pandemic, we can't bring people together, we're trying to do this virtually. So we're trying to set up a website that would have all of those resources with easy explanations on how to apply. So, if you're self-employed, here's how to go through this path. If you are a renter, here are your rights, and, here are potential resources for you. So stay tuned for that. We're hoping to stand it up in a matter of days. And we're trying to make sure that it will track all of the most recent changes, because the government resources are changing on a day-by-day basis, right? The state's issuing new directives and new support resources. The federal package, people are still trying to unpack everything that will have for different types of people and what the resources will be. So thank you all for taking your time to check in with me tonight, and I look forward to chatting with you again. The next Fireplace Chat will be on Sunday, and if you have any questions that I didn't cover, we will definitely try to follow up via social media and answer them as best we can. And again, take a look at the modeling data, but remember that this is always changing, right? And we do have an opportunity to change the way we do business, to look at implementing other measures that might also help us flatten the curve, right? Things like that aggressive case investigation, things like more aggressive testing, thermal scanning. I mean, we are going to throw everything we can at this thing, and we are going to try to make sure that everyone in our community comes through it together, because we are only as strong as the most vulnerable member in our community, whether they are vulnerable and susceptible to COVID-19, which is one thing, or whether they are vulnerable and susceptible to the financial and economic impacts of COVID-19. I want you to know that I will keep fighting for you. I am working 7 days a week to try to make sure that our community stays safe, not only medically, not only with respect to their health, but also economically and also socially, right? So don't forget, check in with your neighbors. Just reach out and send a text. Try to do some FaceTiming or Zoom or Skype. Just check in with people, because this is going to be a long haul. And I know that a lot of people are anxious and reading maybe a little bit too much news. So if I have my last piece of advice is maybe, turn off that news and pick up a book or call a friend, listen to a little bit of music, and just take care of yourself. We're all in this together, and we're going to get through this together. So have a good night.